All right, so I'm going to talk to you today about staff-assisted hemodialysis because of this question right here. And it's different than HHD or home hemodialysis. So who can get staff-assisted hemodialysis? How can you qualify for it? And how can Medicare cover it? So the difference between the two, home hemodialysis or HHD, the patients or the caregivers are trained to perform hemodialysis at home using a system like the Next Stage, a very small portable hemodialysis machine. The patient's responsible for inserting the needles, setting up the machine, monitoring the treatment, cleaning up the entire process. It works best for patients who are independent or who has a caregiver that can assist them. Now, staff-assisted hemodialysis, an actual healthcare professional, so a nurse like myself, would come to your house and manage the entire dialysis process for you at home or maybe in a special setting. They handle everything. They set up the machine, they insert the needles, they monitor, they clean up. This is good for patients who need professional support due to some kind of medical or physical limitation. Or you just have a lot of money and you can afford it. So how can you become medically eligible for staff-assisted hemodialysis with Medicare? It's really hard. Medicare doesn't routinely cover staff-assisted hemodialysis at home unless there's a medical necessity. So this must be well documented by your healthcare provider. So your doctors, they really need to document so they can show proof as to why you need this covered under Medicare. So certain eligibilities include physical limitations, like patient with severe physical disabilities, loss of motor skills, advanced arthritis, or real severe vision impairments that can make self-care or caregiver-assisted care impossible. Cognitive impairments, so conditions like dementia or other cognitive disorders that prevents a patient from safely managing home hemodialysis. What else? Complex medical needs. So if you have frequent complications during dialysis, like unstable blood pressure or access issues, that's constantly recurring access issues that requires professional oversight during every single session, that's an example of the complex medical need that should be well documented. So your provider, your nephrologist, must submit thorough documentation here, including medical records, test results, a letter of necessity explaining why staff-assisted hemodialysis is critical for your health. So, even with documentation, Medicare approval can be challenging. In some cases, patients need to appeal the case if Medicare denies it. So, who offers staff-assisted hemodialysis? And remember, this is not going to a clinic and sitting in a chair and getting hemodialysis. This is you sitting in your house. A nurse comes in with a hemodialysis machine and another machine that can clean water and sets it up in your house, in your living room, in your bedroom. Once you're done, you go. Or maybe a privately owned clinic where you only have like one patient, two patients, 80-inch screen TV, chairs that heat, recline. I used to work for a company that actually had that. So, who offers staff-assisted hemodialysis? I know Dialyze Direct offers it. American Renal Associates offers it. In Houston, we have a company called Quality Dialysis that offers it. So it's usually some kind of some local home healthcare agency or provider that provides home-assisted hemodialysis. So just look it up, Google it. Your nurses, your techs, your social worker even, they may not know about this. Talk to your nephrologist. Ask the kidney doctor if they know a company that offers staff-assisted hemodialysis if you can't find anything online. So what's the benefit from staff assist versus HHD? So home hemodialysis is good for patients who want control over their treatment schedules, to feel confident managing their care. Staff-assisted hemodialysis are good for patients with severe physical, cognitive limitations, or those with medical conditions requiring professional oversight, or people who just don't want to go to a freaking clinic and they have the money to afford staff-assisted hemodialysis. You can also get staff-assisted hemodialysis if you have private insurance that covers it. Sometimes your job insurance may cover it, or you can just pay out of pocket. So that's just an FYI. It doesn't have to be Medicare. So Medicare covers HHD as a standard benefit, so that's home hemodialysis. But staff-assisted, like I said, requires prior authorization. Like I just said, private insurance can offer better coverage, so you can get staff-assisted options. Otherwise, you're paying out of pocket. So both of these dialyses are great. They can make life outside of a clinic way more manageable, but they're designed for different needs. If you think staff-assisted is for you, talk to your healthcare team about it. Make sure your doctor is documenting everything if you need to use Medicare, and contact local providers to see if you're approved. Take care. Ciao.